Merkley, this side of the room is completely ignored through this lottery system. Can one person ask for one question?
Yeah, can we have more questions, please?
All right, let's have everyone raise their hand here. We'll have Rosie, who wants to ask a question, we'll have Rosie pick someone out.
Yeah, let's keep it open and fair, Senator.
Oh, I'm going to pick a person? It's not a chicken?
And I'm a young person who's concerned.
No, this group over here.
Okay, I don't know anybody over there. The lady in the front with the red shirt on.
Me? You? My name is Pam Driscoll. I live in Dexter, and I'm really concerned about Wyden's ONC bill, the forestry bill, for a lot of reasons. I've been working on climate change for the last 15 years, and from what I understand, we have about 2 to 3 years before runaway climate change is out of human control. And deforestation is the #2 reason for climate change. And it's so interesting that Governor Kitzhaber is working with with Washington and California on this climate bill when he is promoting the clear cutting of 1.6 million acres, because he's talking out both sides of his mouth. So there's a lot of solutions to our economic problems that don't involve destroying our forests, which sequester carbon, which we could actually get paid for. There's the thinning of the forests. There's the timber harvest tax, which is much lower than California or Washington. There's just a lot of different things we could work on for our revenue. And I just wonder how you feel about this bill and in relation to climate change and our fish and our clean water and our economy.
So thank you. I'm getting a lot of feedback on the bill, and in fact, I was driving up here from the south. I was reading a series of memos that different people have written, laying out their concerns, their support, so on and so forth, and I'm trying to channel some of those key points into the conversation that's taking. I'm not on the Natural Resources Committee. I think it is a complicated story because we have a lot of second growth on BLM where trees are the same age, they are not good for biodiversity, because they're so small and so tightly packed, they are a hazard for fires, they cultivate more disease, and we have such a complicated patchwork that you go 300 yards from any forest piece and the forest is different. And so how do you develop a plan that protects the most sensitive pieces and increases the health? And I think these lands did have a role in timber production in Oregon, and the public trees go to our mills, which produce lumber, whereas the private trees are being shipped overseas. So our mills are dependent upon logs from public lands. So my general sense has been that we have to protect the sensitive parts of the forest, and the sustainable production, the rest has to actually be sustainable and has to help improve the forest health. And that's the type of balance I think would be appropriate, and I'm trying to wrestle with the nitty-gritty details and provide feedback within that framework. And it's not exactly what you want to hear, I know that. So I'll still be here for a while if you want to come up and ask individual questions. And I'd like to close with if there's any other high school student who would like to ask one. Any other high school students? Okay. I want to just close by thanking you all so much. And nobody asked about health care.
I have a question about health care. Well, I've got a question. Why don't you talk to us about health care, Senator? Why don't you tell us about the health care debacle, Senator? Explain to us what's going on with this mess. The failures of it, Senator.
I want to give you a little sense on some of the things that are related to the Affordable Care Act.
Yes, thank you.
Already happened. And there are many pieces of the Act. The state website, of course, we know, is a big flop.
Big flop.
And the state's working with Oracle to try to change that, but right now we're having to operate from paper. I did invite David Berenberg to come. David, could raise your hand. If anyone has had difficulty with the website or has someone close to them who's having difficulty, David can help connect them with the experts. I think the most recent numbers are that the expansion of Medicaid and the sign-ups for insurance through the website, through the marketplace, if you will, are, even though it's by paper, it has now hit 150,000. And so it's gaining some momentum. But we would like to get to the electronic end of things. So David has cards and we have help, and I really appreciate, he's come to all my town halls, so to be available to assist people on this. But let's talk about some of the other pieces of the Affordable Care Act. More than 20,000 Oregonians have received rebates under the 80% provision. Now, it used to be an insurance company could spend a lot of their money on administration and not deliver health care. Now they have to deliver 80% of their funds have to be spent on health care. So more than 20,000 Oregonians have gotten rebate checks when their companies fell short in this regard. More than 30,000 have saved money as we've proceeded to start closing the donut hole in Medicare Part D. We're at the 50% level, and it gets completely to the 100% level by the year 2020 under the plan. Imagine there's some folks who have benefited from that in this room. We've had more than 40,000 young Oregonians, 19 through 25, gain coverage through their parents' policies because of the age 26 provision. We've had more than 900,000 Oregonians take advantage of free preventative care, which goes right to the heart of an ounce of prevention is worth a pound of cure, and we didn't have that in the past. We have 1.3 million Oregonians who no longer are subject to lifetime or annual limits. This is a situation you have, there were these practices. You thought you had insurance, and then when you got hurt, after a few days, you had an annual limit or a lifetime limit that ran out, and it's like, whoa, I didn't actually have insurance. Or you thought you had insurance and you got sick, and then you get a letter upon renewal saying we're not renewing your policy. It's called a rescission. You got kicked off your insurance when you were, if you say you had a serious disease, you still have that disease. And then you had a pre-existing condition, you couldn't get insurance at all, unless you were fortunate to be able to get it through an employer. And so, and in regard to that pre-existing condition piece, I would say the majority of us in this room have pre-existing conditions. Now, not because you all look ill, but because the statistics are that for folks in their 50s, about 45% of us have a pre-existing condition that could disqualify us under the old system. And as you go to your 60s and 70s, the numbers go up. And that is a huge challenge that didn't make the insurance structure work. Plus, we have the potential for the competition between companies in an apples-to-apples framework that hopefully will drive prices down.
There's no competition.
Now, there are things that are not going to work. And here's the heart of anything this substantial. You've got to keep the things that are working, and you've got to fix the things that aren't. And whether you're a Democrat or a Republican, or you come from the East Coast or the West Coast, we need a problem-solving mentality to come together and make health care work better for all Americans. So thank you for coming out. Thank you for sharing your concerns, your ideas. This is Dan on my team. He is my field